Please can you remind me, if you'll be so kind, staring out into space, asking God to hear my case, trying to think of all things past. How long will my memory last? A purple angel, purple angel, purple angel, you're next to me.
Hi everyone, and welcome to Alzheimer Speaks Radio. Today this is a video session, so you will have an opportunity to either listen via audio or watch us, which is always kind of fun to do. For our new listeners, because we're always getting new ones all around the world, I always like to just tell people a little bit about us. Bottom line, we are an advocacy-based company providing multiple platforms to help shift our dementia care from crisis to comfort around the world. And we do that not just through the radio platform, but we have a blog, we have a website, we do speaking and training, we do a really cool thing called Dementia Chats where we interview people with dementia and they tell us how they'd like to see the world, which is pretty fascinating. We are also known as a media outlet for businesses that want to kind of leverage our audience and get their word out of their products, services, and tools, which I can say as a daughter who had a mom with dementia, I really missed having those connections when we needed them. And so that's really one of the reasons I created Alzheimer Speaks, was to be able to connect those in need with all of those products, services, and tools that are available that most of us don't know are even out there. I also want to say thank you to our audience. Because of you, we have gotten some major recognitions from Oprah to Maria Shriver to Dr. Oz. And, you know, that wasn't done by us. That was done by all of you. Taking just those few seconds to like what we're doing and share the content, which I think is really critical. Again, as a daughter who was really in need, I wanted to see information and there wasn't anything to be had. And sometimes there's people in your sphere of influence who are in need but might not be ready to grab stuff yet, but it allows them to get educated in the process, or at least know that there is a place to go to get help when the time is right. And for all of us, you know, it might not be our own family, maybe it's a friend or a coworker that's going to be in need as well. So before I introduce our lovely guest who's awaiting patiently here in the realms, I like to give a shout out to a few different companies. One of them is Maria Shriver's Women's Alzheimer Movement. She's just doing some great things and focusing on research to see why do women seem to get dementia more than men. And if you'd like to learn more about her and her Move for the Minds program or her Sunday Peep, you can go to the Women's Alzheimer's Movement.org. Another company I would like to just give a shout out to is Dementia Raw. I just went through their training program for their certified dementia communications specialists here in Minnesota, and if you have a chance to go, it's absolutely fabulous. They do a lot of improv, but it was well worth the 2 days, and it blew by. They really made it fun. The last one I want to mention is I'm very excited to say that I'm going to be a founding member of a new organization that's just rolling out here in the U.S., and that's World Kindness USA. They are in many other countries, but they are just coming here. They did a soft launch in LA, and there's going to be a major launch that's being done in Maryland coming up here shortly. Check them out. It's World Kindness USA. So with no further ado, please let me introduce Carol Chiarito. She is the founder of CarematchAmerica. And she started her company kind of like I did, due to her own journey with her mom through Eldercare. She's also documented in a book, which is called It's as Simple as Where You Live, a guide for beginning the journey into elder care. Through her work as a financial advisor, she realized all of the components that are missing in most people's understanding and search for care, which again, through her own journey, she knows how critical it is. And so she created a network across America to change the way people understand and plan and find care. So welcome today. How are you doing, Carol?
Doing well. Thanks, Lori.
Well, I am thrilled to have you join us. I would like to have you tell a little bit more of your story of, why you started Carematch America. I mentioned it had to do with your mom, but it'd be nice to just get a little bit more details of what you went through as a daughter.
Well, I was very privileged to have a mom who was very forward-thinking, and when she noticed some things happening with herself, that she wasn't remembering things as well, and she just wasn't getting around as well, she asked me if I would take her to look for some possible assisted living homes so that she could decide if she wanted to go ahead and move in, or when the time did come that she might have to move in, she wanted to have already picked where she wanted to go. So me being the perfect daughter, I said, sure, let's go look around. This would be fun. So she had one little thing, and that was her little dog. She had a little dog, Jenny, that she wasn't going to go anywhere without. So if we did find her a place, I needed to find a place that would accept a dog. And I didn't even know if that was possible. So where do you go? This was back in the early 2000s, 2007, 2008. And I consulted the Yellow Pages first, which didn't take long for me to realize that I wasn't going to go anywhere there after pages and pages of assisted living. Then, of course, I summoned the all-popular Google, and there we go again, more pages and pages. And I just wanted to find a place that took a dog in my area. That's all I really wanted at that point. And there wasn't a way to do that. So I came to the idea that it should be as easy as finding a hotel. So I wanted to create the hotels.com of Eldercare. And so that's how we got started. Come to find out, my mom didn't even need an assisted living. She qualified for an independent, but at the time I didn't even know that even existed. And throughout our search, we ended up finding her a wonderful independent living. She moved in within a couple of months, took her little dog, and she lived there for several years before she needed to move over to the assisted living side. So that's how I started Carematch. Much like you, it was really hard to maneuver the course of understanding and finding the right place. And I just figured through my journey, I needed to share that with the world to make someone else's life a little bit easier.
Well, I love that because I think, when you go through something, when you're struggling like that and realize you're not alone, it's I just find it really rewarding to kind of give that hand up to the next person. And you had mentioned about independent living, like, well, what's that? I mean, there's so many terms out there, and some of them are similar communities, but they use different terms. And some of them actually are different levels of care. So it does get really, really complicated in terms of what do you ask and how do you ask it, and how do you maybe ask it multiple times to see if you're getting the same answer, because are you talking the same lingo that they're talking? Because a lot of times that's not, you're on different pages with things. And so, that fun journey of, let's go explore can get really overwhelming for many people very, very quickly. Why don't you tell us how Carematch is different from other sites on the internet that, are saying that they'll help you find a place to live?
What I didn't mention is when I did go to Google and try to find a place for my mom, I was looking, and finally I found a site that I thought would probably help me. But I had to enter my name, address, and phone number to get the answers that I needed. Lo and behold, I did that. Come to find out they couldn't help me on my own because the phone started ringing probably within 5 minutes of the time I pushed send. And what I found out that I was nothing more than a referral. And everyone in that area within 50-mile, 60-mile radius began calling me within the next 45 minutes. It was one call after another. And I thought, really? This is how it works in this day and age. People are calling me to lure me to come to visit their place. That's not how we do business. And So I made a vow that we would never be a referral company. We would never treat our seniors and their families as a referral so that we could gain monetary impacts on our own company. My mission is to help people find their way without being bothered by the phone calls of the referral system. And so that's one way that we're different. The other way is that we really do care. Our logo has a heart on it, and we call ourselves the company with the heart, because everyone who works for us has either gone through this process themselves or is currently going through this process. And so they know where people are headed. They know where they might have already been. And we want to make a big impact by not just being any old person on the other end of the phone, or actually making it so that, you know, we're caring about what happens for the next steps of the person who's looking for the right fit for care.
I think when you mentioned about getting all those calls coming in at you, I mean, you just kind of, I mean, I would feel like, what did I just do?
I did.
You know, I can't trust any of these people because this isn't what I thought it was to begin with. And now I'm overwhelmed to begin with, and now you're bombarding me with all of these calls, and I'm trying to make progress and maybe have a conversation with somebody who I'm really interested in. My phone's beeping, and I'm missing every other word now. Thank you very much. So, yeah, I think there could be a lot of deceiving things out there where people don't know that their name is being kind of trapped and sold. And it can be frustrating even when they go to place, hearing stories of what happens with that, because they don't know how the process truly works. People think, well, you're going to help me find a place. So do you have, when someone contacts you, do you have one person then that is in contact with them, helping them sort through the process then?
Yes, we. If someone calls in on our concierge line, that's what we call it, is a Carematch concierge. That person is assigned a concierge. We do what's called a situation list, where we try to understand what it is someone's looking for and where they're looking for it. Sometimes people are looking in a couple of different areas. You know, they can't decide if they want to live here where they've retired to in Florida, or maybe move back to Atlanta where their kids live, for example. So we're helping them to understand what the choices are, and then we go out and actually find some places, whether they're clients of ours or not, whether they're advertising on our website or not. We try to find the best fit for the person that's looking. And along the way, educating that person on how to pay for the types of care, and, you know, what obstacles may lie ahead. You know, staying at home is one idea that a lot of people have. Some people don't want to stay at home, and they're clearly ready for the social activity that being around other people may bring. So we try to bring all those things to light to not only the senior, but their families. The other thing that we do that is quite unique is we encourage the families to get together to have these conversations together. So it's not just the child talking to me about what to do with mom or dad, or it's not just mom or dad deciding what to do without talking to their family. Chapter 4 of my book is called The Kitchen Table Talk. And I often laugh because, you know, when you were a kid and your parents called you to the kitchen table to have a talk, you knew something was up. So I named it that on purpose because, you know, I feel every family should have this kitchen table talk sooner than later. We don't want to wait until the boat capsizes and mom or dad has a stroke or is diagnosed with dementia or Alzheimer's before we've actually had this conversation, because I feel it's very important that the senior gets to choose what they want. And a lot of times they don't get a voice in some of this decision making. And so that concierge not only helps them understand the process, but tries to bring them together as a family, coaching them on things and ways to have conversations and have that kitchen table talk, as well as leading them to what we call our Carematch advisors, which can help them uncover how to pay for care and figure out where they are in the whole payment of, it seems like a huge obstacle, but a lot of times once you break it down, it's not as big as it can be. So that's the other part of what we do.
Well, I love you talking about, the situation questions, because a lot of times people just, and I've seen, and I've been in the senior market forever. I've been in the dementia arena specifically professionally for about 10 years. But prior to that, I was in residential real estate. And that's what my focus was seniors, trying to ease that process, get everybody on the same page, because the kids are on one page, the parents are on another page, and the professional is just seen as someone trying to glob onto their money and control things and kind of be in and out. And so I think it's really important to ask those questions of, why are you thinking about the move? Where do you want to live? What is your timing? What do you project your life to be, in the next, near future or 5 years? And in terms of, so you can make that the right place for them, because people don't like moving once. And they usually don't move in 2 or 3 times afterwards unless they know that that's coming. But I think so often people move into a place thinking, oh, this is where I'm going to spend the rest of my life. And then there's more things ahead. So getting to know health status or just general wishes about being with family, or, how social do they want to be? It can be critically important. And I love that it's one person that they're talking to, so that you can develop that relationship. To me, that was, when I was in real estate, that was such a critical piece. And I was amazed at what we could do together, in terms of that counseling piece of getting families on the same page. And a lot of times it was a simple matter, and I'm sure you've seen this, where mom or dad is thinking about moving, but they don't want to say anything because they don't want to lose their independence and they don't want to be a burden to the kids. And the kids are seeing changes, thinking, oh, I should bring this up, but I don't want to get in a fight. And oh my gosh, if they agree with me, then I got to deal with this move and I don't have time. So both sides stay silent, but it's not meeting either of their needs. And getting them to understand not only the physical move is important, but both of them getting in that emotional safe place, where they're comfortable and feeling well cared for themselves and for others in their family and stuff. So do you assist them in terms of the move process in your concierge service, in terms of if they need a painter or a mover or somebody to pack them? Do you get into that portion too?
We do a little bit. That's not necessarily our mantra. We would like to add that on at some point. If we know someone in the area, we will connect with some of those people. But our mission is just to find them the right match for their place to live at this point. And we try to focus on that well-being issue.
Okay, and that's wonderful. Now, when it comes to the CareMatch advisors, are those actual financial planners then that they're talking to at that point?
Yes.
To help assess, their costs and things? Because I know, again, when I was in real estate, a lot of people are like, oh, I can't afford it, but they're sitting on this home with all this equity and they're forgetting, well, if you move out of here, you're probably going to be selling this, right? And so how can we get those assets to work for you? And trying to help them compare apples to apples the best they can, because sometimes they're thinking, well, I don't have a house payment. Now I'm going to have this big payment. But, again, if you're shutting 3/4 of your house down because you're not using it, or you're scared to do the steps if it's do the laundry or go to the bathroom or go to bed and afraid of a fall, that's not a healthy way to live either.
Right.
And so finding that right match, or again, maybe lack of social interaction. And giving them, I think, that piece too of nobody moves to become more dependent. The whole goal is to make them as independent as possible and just change their living environment, because for all of us, that's the only reason we move. Our needs have changed. And yet when we're older, I think people always go to this end of life thing. Well, you might be 70 years old, but that doesn't mean you're going to die soon. People are living to 100, 80s, 90s. I mean, none of us know that. And so I think that that's a kind of a factor that needs to get changed too, because that creates so much fear in terms of the move and in the struggle with that. So I love the support that you are bringing to people to help them sort out this complicated mess. Now, one of the things that people are always going to ask is, how much is this going to cost me? Because you guys can't all be that kind that you're doing this for nothing. And so people like to know, how does the process work?
We like to try to get the communities, the facilities, the home health, and the healthcare providers to advertise on our website. First of all, it makes it easier for us and our concierge to actually direct people to the website and see the shopping mall effect, if you will, of one place to go and see everyone. But also when we're helping someone in a community, let's say Atlanta, and we have people who have showcased their businesses on our website, we're able to just send them the links that give them a side-by-side comparison to 2 or 3 different places. So that's one way that we earn our money. So the concierge part of what we do is free. When we help people find the 2 or 3 locations in their area that we feel would be a perfect match, that part is free. Now, if someone is having some issues with the family disagreeing on what type of care, or maybe mom is not willing to even take a look at care, even though the family feels that it's highly needed, then we have different packages available for typically me to go in and become the mediator and to have discussions with the family and with mom or dad about some choices and what they need to begin to look at. And so there are various things that we're able to offer. Then the other thing is the advisors that you spoke of earlier. These are financial advisors, also elder care attorneys, and as we move forward, anyone who could be an actual trusted advisor for a senior. I choose financial advisors because that's my background. That's what I was for 15 years. And it seems like, that's where the money is going to come from. And that's where, an advisor has the creativity and the ability to know how to manipulate the different buckets of money in someone's life, and Social Security and Medicare and Medicaid and all the other things that come into fruition. But these are trained financial advisors. We train them through a series of classes that we have developed, and they have to go through that to understand what we're looking for. And so they sign up with us to actually go through our training and to make us feel good about referring them out to people in their area. So then if someone does go to one of the financial advisors in your area, they will offer at least one free meeting with the referral person, and then they can decide on where to go from there. Some advisors charge. Most of our advisors don't charge for their services. And sometimes, they can easily sum up what needs to be done in 1 or 2 meetings. So it kind of depends. So the answer to your question is typically there is no charge for the services that we provide to the consumers.
Okay, great. Because, like you had mentioned before, some of the others are a referral service. And so some companies are still trying to get a referral from a place, from a community and things, which I don't think people have an issue with if they know. I think a lot of times they don't know they're being used as bait out there. And in this situation, you sound like you're really doing some significant hand holding. So it really isn't a bait and switch type thing, which I think sometimes people feel can happen to them out there. So I like that you are doing training with the financial planners. I know sometimes when I have talked with, and this can happen with this can happen with any industry at all, where some people want to be part just because they see big dollar signs, but they really don't want to counsel. And it sounds like you're really in it to counsel people to do the right thing. So do you ever turn anybody down who wants to be part that you think isn't a good fit? Have you ever run into that?
When we have an advisor who signs up with us, we have them fill out a questionnaire, like what is their background in working with seniors? What have you done before? And why do you even want to? Tell us your story about, what you want, why you want to do this. And then we also do a background check on them to make sure that there hasn't been any bad things done in their career. So far, when we talk about this program to a group of advisors, again, so many people are going through this, Lori, it's hard to go anywhere without finding someone who's going through this situation, either with themselves and their own family, or a close friend, or an in-laws. And so typically most of the people who sign up for advisors are signing up because they have the heart for it. They are going through this or have gone through it in some way. And there were a couple who were not, a couple advisors who did sign up and passed all of our criteria, if you will, but weren't going through it. And they just weren't as successful as some of the others. And so they didn't do their part of it. So, I can give you a kit on how to do something, but if you just set that kit up on the shelf and never do anything, magic doesn't really happen that way. So those advisors who become involved in their community and their clients, our whole thing, Lori, is our advisors, myself included, we're not talking to our clients about preparing for this day. We may sell them life insurance to prepare to die, or we might sell them long-term care to prepare to pay for this situation, but we're not talking about the behavioral aspects and the real aspects of what kinds of things are going to happen when this time comes along. Where do you want to live? Mrs. Smith, where do you want to live should this time come? Do you want to live with your kids? Do you want to live at home? And having this conversation with seniors and or their families is presenting a whole new concept of planning, because now we're not doing something at the very last minute. I love your tagline. I wrote this down. Shifting dementia care from crisis to comfort is what you have on your tagline. And I thought to myself, that's exactly what we're doing. We're shifting finding care from crisis to comfort. Because with my mom's situation, for example, it was much easier for her to just sit back and go, if something ever happens for me, I've already picked out where my daughter's going to move me. I already know where I'm going to live. I've already toured it. I've already visited with all the people there. It was a comfort for her knowing that she knows what the next step is going to be, instead of the fear of wondering what lies outside that door for me. And I think that is another one of our big missions, is to get those advisors to have these conversations with their clients and their clients' families. And that is the first step in preparing for care. You can't wait until tragedy hits.
I so love when you talked about, your mom felt comfortable what the next steps were, but that had to make you feel comfortable too, because now you're on the same page. And I remember doing some training for some financial planners, and like any other industry, it was, you get the gamut. So I had people in tears going, I so get this. I want to help. I want to become dementia friendly. I want to counsel people. And then I had others going, I'm not a counselor. I'm a they were very black and white. That's not my job. Mm-hmm. And, we had a real honest discussion that then maybe you need to refer out this type of client. We're not everything to everybody all the time, but but knowing that, and I love that you're trying to get them to plan ahead to have these conversations, or even, we had talked about, who's going to be your power of attorney, because a lot of times financial planners are finding habits change in terms of how they're dealing with their money, and yet, they're not necessarily supposed to report it to a social worker or get the county involved. But having that honest conversation, if this would arise, how would you like me to handle this? Because it happens quite frequently.
The next step and saying, you know what, I think it's time for me to meet your family. Let's get everyone together. Let's all sit down and let's talk. Because if something does happen to you, I need to know your family, and they need to know me.
I got a lot of pushback from some advisors on that, going, again, that's not my job, and I don't want to get involved. And I'm like, you could pick up family business, just like I did with real estate. They're like, oh, thank you so much for helping my folks. And all of a sudden you've got their business, and you've got their kids' business, and you've got friends' business. And it's that sincerity, I guess, of doing good work and being kind and being authentic and being able to relate and have that empathy and that compassion for what they're going through. You were talking about planning for physically what's going to happen, but emotionally, how you're going to feel with all of this. You're going to have good days and bad days, just like you have right now, but they're going to become more intense when you make a move. That's just part of the process for anybody going through a move. And so getting them to understand that that's more normal than not, I think is so critical. Can you tell us, in terms of area, where all do you cover? Are you national? Are you just local?
We are national. CarematchAmerica. It says, the name says it all. As we're launching, we're getting to know more and more communities. We're getting to know more and more cities. We've been everywhere from Connecticut to LA to Pensacola, Tampa, Minnesota. We've gone all over. So our mission is to get people to understand why they need to build a showcase on our website. And when I say people, I mean providers, home health care, elder care communities, from independent, assisted, skilled nursing, even rehab, because our concierge calls come in from all over the country. When we do marketing in a specific area, our concierge calls come in. And the way it works is, when we sign up an advisor in a specific area, we flood that area with marketing in one way or another. And those calls come in, and we don't have the communities and the home health or whatever available. It makes it a little bit harder for us, but we may not be finding the people who don't have websites or aren't advertising like they could be. So we're getting the word out so that we can all join together. Our whole thing is, it takes a community to get anything done. And if we want to really support our seniors between now and this tsunami that's coming forward with all of us boomers, we've got to learn to work together, and we've got to figure out the best ways to work together. And I think that's a really big point. Going back to the referral companies, one of my big pain points is, there's one company that we work with that has admitted that they spend over $34 million in referral fees a year. I say, what if you took that $34 million and put it back in your bottom line, and maybe hired more caregivers or whatever it might be to actually help the seniors more? And I think that really needs to be brought out in how much money is being spent, because it's very inexpensive for someone to build a showcase on our website, and we could give you one referral, which would pay for that ad for 15 years, really, because it's very inexpensive. And it doesn't matter if we give you 1 or 100, it's the same price. So you're able to budget that for the entire year. So, one step at a time. I may not be able to help every senior in America, but you know what? I can help one today, and hopefully I can help one tomorrow. And one step at a time, we're going to make a difference in the way people think and feel and plan and care about senior living and elder care.
Your point on that 34 million, people just, and I've heard that statistic before, and people's jaws just drop. They just like, oh my gosh, because we do have a shortage of staff and not meeting program needs. And yes, it could be done so differently. Now, one question I didn't ask you, and I'm assuming that you deal with people with Alzheimer's and dementia and Lewy body as far as their placement. So you could work with memory care, brain injuries, and those types of things as well.
My mom did end up with Alzheimer's, and that's when I mentioned she moved from the independent living over to the assisted living. It was tough. It was tough for her to accept the fact that she knew things were going to get worse, and it was tough for the family to go through that. Again, that fear of not knowing. The Alzheimer's organization was a huge help here in where I live, and so we've become quite good partners with them and knowing, reading up on all of the wonderful things that they have available that they can do for people in the community. And I think it's so important that people know that they can reach out to organizations like that. But absolutely, I think that that's probably the area that's closest to my heart, just because, we've been there, we've gone through that, and I've seen the awful things that the disease that can do to people and rip families apart if we can't somehow get them together and get them all on the same page from the get-go. That will keep things from dissolving later if we all know what lies ahead. So yes, we definitely have a big heart for dementia and Alzheimer's.
The other thing is, and I'll just mention this too, because I've seen where some people with early onsets they'll pick out a place that they're going to live. They're not ready to move yet, but they'll start volunteering. And so, even from an advisor standpoint, in terms of being able to talk to people about that, you can get involved with the community so you're a little bit more comfortable with staff and the lay of the land there, that when it's time, now you're moving in with friends. You've already established, relationships and stuff. And plus it gives people purpose. How do communities and financial advisors and elder law attorneys and stuff become involved in your movement, Carol?
For the care communities or the home health to just go to our website and sign up and build a showcase. It's about as easy as building a Facebook page. I guess for those of you who think that's easy to build a Facebook page. But what's great about the website is that once you build a showcase, you can change out those pictures. You can add YouTube videos every day if you wanted to. So it's a really great place and way to showcase yourself without having it just be set in stone for a whole year or whatever that is. So, and also on our website, CarematchAmerica.com/advisors, financial advisors can go in and look and learn a little bit more about the process, and then let us know if they're interested. And we like to interview people on that side a little bit more and get to know them. So, or they can just contact us directly at 1-888-MATCH-70.
888-MATCH-70. If you can't remember that, is 888-628-2470. Or again, you can always go to CarematchAmerica.com for more information. And I would imagine you have a contact us button if somebody wants to email you. But would you like to give out your email address as well, Carol?
Absolutely. Anyone can email for more information at info@CarematchAmerica.com. That's info, I-N-F-O, at CarematchAmerica.com.
So I really appreciate you stepping into this space and trying to improve it and having the heart to do it. You really sincerely seem to want to help families. It's not about the money. It's really about the process itself and pulling people together into an effective process that's gonna better the world. It's going to be better for our seniors, for our families, and for our communities as a whole. And I think that is such a critical piece. And so I love your approach. So thank you so much for the work you're doing. Any last comments? Anything that we didn't cover that you'd like to share with our audience?
I think that I have just one piece of advice, and it's from my friend Dr. Bill Thomas, who's part of the Eden Alternative. I'm sure you know the Changing Aging, Disrupting Aging Tour, all of that. But I was listening to Dr. Thomas one time when I was at a convention that he was speaking at, and he said the problem with not only seniors but ourselves, everyone probably in general, is that we tend to compare ourselves to who we used to be, instead of comparing ourselves to others our own age. And so for those seniors out there who are listening, or maybe even boomers, I know sometimes we all have those issues, right? Looking in the mirror. I have that advice for you. Change is inevitable. The future is coming. It'll be here tomorrow. Stop looking backwards. Stop thinking about who you used to be and what you used to be able to do, and start thinking about what you can do today and what you want to be able to do in the future, and live for that. And I think that is probably something that I try to remember from my own point of view every day. But I used to remind my mom about that. And she was 87 when she passed away. And I remember her saying, "Oh, what I wouldn't give to be 70 again." And I'd say, "But Mom, you're 87. Let's go find some other 87-year-olds that aren't doing as well as you, and it'll make you feel better about yourself today." And she would just laugh and carry on. But I think that would be, my parting word for the day. Think about things before they arrive, plan ahead, and let Carematch America show you the way.
Carol, one thing I do want to ask is, how do people get your book?
My book is available on Amazon.com, and you can also click on in the website. You can click on it there. It's they're listed as resources, and get it that way. I think that sends you right to Amazon as well, but that's probably the best way to get it right now. If you want an autographed one, you can contact me and tell me your story. I'd be happy to send an autographed book out and dedicate it to someone that you love.
Well, thank you so much for your time today. Again, we have been speaking with Carol Chiarito with Carematch America, and you can go to their website at CarematchAmerica.com to get all kinds of information there, or feel free to email her as well at info@CarematchAmerica.com. Or you can call at 888-MATCH-70, and that is 888-628-2470. I want to thank everybody for listening, and please share this with others, because there's so many people that are struggling, trying to figure out, how do we get through this process? Where do we start? Sometimes it can just make people go down the rabbit hole and not look, because it's just too overwhelming. So let them know that Carematch America is out to help them. In wrapping up, I just want to give a shout out to a couple other companies. One is Calendar Cards, which is a memory system. They are also wonderful sponsors and administrators of the Memory Cafe Directory.com. And they have now over 500 memory cafes that they're tracking. And you can easily access that information on their site. And they are starting to do a Europe and Canadian directory as well. And then I want to shout out to the Alzheimer's Research and Prevention Foundation. If you're looking for holistic ways to deal with cognitive issues, they are a great organization, and you can just go to alzheimersprevention.org. And last is the Purple Table Reservations. They're working really hard at trying to get our restaurant savvy in terms of dealing with people that have memory loss, or maybe it's autism, maybe it's ADHD, post-traumatic stress. But purpletables.com is you'll find more information about them, and they are helping restaurants get trained and to be more savvy to serve their clients. So until next time, Have a great week, everyone. Bye now.
Hey everybody, Jared Sebesti here, host of Retire Repurposed. This podcast is dedicated to help people transition into fulfilling and purposeful retirements. Retirement is a big life change. In fact, the two most dangerous years of a person's life are the year they were born and the year they retire. Few people can just flip the switch from working a career 30 or 40 plus years, retiring on Friday without methodical steps to living what we call a repurposed retirement. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.